Okay, good morning, everybody. Thanks so much for coming to this presentation. So as many of you know, this month is Domestic Violence Awareness Month, and the Problem Gambling Resource Centers and New York Council on Problem Gambling recognizes this. So we are happy to utilize this month to share all of the resources that we found based on all of the research that's been done about the intersection between these two issues. So thank you for attending. And I just want to bring to everybody's attention that, throughout the presentation, you might see the phrases domestic violence and interpersonal violence. You'll see both of those terms coming up throughout the presentation. And that's because some of the research we found on this issue referred to the whole kind of umbrella spectrum of domestic violence, which includes any kind of abuse going on in the home, not just between intimate partners. And when we use the phrase intimate partner violence, we're using it because that research was specific to intimate partners. So I just wanted to point that out so everybody's clear on the terminology, and why we use domestic violence as opposed to interpersonal violence. When we do, we are also going to start by just doing a brief overview about the definitions and key concepts around problem gambling. Many of you have been to our trainings before and are probably familiar with this, so it will be brief, but we just want to do a refresher for that for those of you in attendance who maybe haven't gone through many of our problem gambling conversations before. Because of this is a pretty dense presentation for an hour's time frame. So because of that, I am going to ask that we save all questions to the end, just to make sure I get all of the essential nuts and bolts in, and then hopefully we'll have a few minutes left at the end to go over any questions that you have about any of the topics that come up. So a brief overview of who we are for those of you who are unfamiliar. The New York Council on Problem Gambling is a private nonprofit in the state of New York. We are dedicated to increasing public awareness about problem gambling, which is what I am doing right now, and advocate for support services and treatment. And I will end talking a little bit about the treatment and support service structure that we have in New York State in the event that you want to connect to anybody who is impacted by gambling. We also maintain a neutral stance on gambling. We are not for or against gambling. We are simply here to say, hey, this is a behavior that can be devastating for some people, and we want to make sure the public knows about what the warning signs look like and where to go for help. And at the end, as I said, I'll talk more about our problem gambling resource center infrastructure. So as a review, what is gambling? Who remembers? There are 4 key words that we use in the definition. Since there's a lot of introductions going on in the chat right now, feel free to unmute. Do you remember there were 4 key words involved in the definition of gambling? Who remembers? Feel free to unmute and say it verbally.
Excess.
That's not one of these specific words in the definition, but that is very, very important, for a risk factor, right? The more access somebody has to gambling, right? The more likely they are to develop a problem from it, and the more likely communities are, right, to see uptick in problems. So that's a great element for risk factors. What I'm looking for here is 4 key words that define the act of gambling. What are some words that come up?
Unpredictable.
Unpredictable. Well, you know what? That's really close. And there's 2 components in here that speak to that, right? There's the risk, right? And the reason why gambling is a risk is because when somebody places a bet, they are betting with, the risk essentially is the bet, right? And they are betting with an object of value, right? The second component. And that object of value is usually money, right? So it's risking mostly money on a game of chance, right? And the unpredictability, right? You were right on target with that, Carol. That's the chance part. So it's risking something of value on a game of chance with the hope of getting a desired reward, which is usually more money. right? So risk, value, chance, reward, those are the key components. Any behavior that involves all four of these things and involves this process of risking something of value on a game of chance with the hope of getting a reward fits our definition of gambling. Just an overview scope on what gambling behaviors look like in our country. About 85% of US adults have gambled at least once in our lives, and about 60% have gambled in the past year. A very prevalent activity. And just to review, there are a spectrum of gambling behaviors. Some people don't gamble at all for various reasons. Many engage in social or recreational gambling. And since gambling is inherently a risky behavior, sometimes, we call that at-risk gambling, right? In the social or recreational stage, where depending on other vulnerabilities, there's a possibility that it could progress into problem gambling, but right now, it hasn't hit that. And many people can, just stay in this social, recreational, at-risk gambling stage and not progress. For those that progress into problem gambling, they usually kind of cross the Rubicon into this red area once the gambling behavior directly impacts other areas of their lives. That's when it transitions to problem gambling. And that's generally, when we start stepping in, to do our awareness and direct assistance to people impacted. And then the far end of the spectrum is gambling disorder, which are, as many of you are now aware of, is now a diagnosis in the DSM-5, and it is something that people are eligible to get clinical treatment for. Now, when looking at the warning signs for what constitutes for gambling disorder, here are some things that clinicians typically look at, and even as like a layperson, even if you are concerned about somebody you care about, or even yourself, this is a good list of behaviors to look at, right? Is somebody gambling, to gambling as a means of coping, essentially, right? To avoid certain uncomfortable emotions? Are they neglecting other responsibilities because of the way they're gambling, gambling with money for necessary expenses, relying on others to get out of debt, and having, feeling desperate, depressed, or even suicidal because of their gambling, right? These are all things to look for that indicate that gambling has definitely become a problem for somebody, and it may even be gambling disorder. So those are some things to keep in mind if you're concerned about somebody you love. And when it comes to gambling problems, about 2 million adults, roughly 1% of the population, are estimated to meet the criteria for severe gambling problems, right? Including gambling disorder. Another roughly 4 to 6 million are considered to have mild or moderate gambling problems. So that's a little bit of an idea of what it looks like in the scope of our US population. And you might think, okay, these numbers are not terribly high, right? 1%, 2%, 3%. Why is this a concern? If these numbers are relatively small compared to other things. Well, it's important to remember that one person with a gambling problem impacts at least 10 other people, right? I mean, think about it. If you're the family member of somebody who has a gambling problem, the emotional and financial impacts of their behavior, if it reaches a certain level of severity, are going to impact you, right? I mean, when people come to treatment, most often the top two consequences of their behavior are financial losses and relationships being jeopardized. So we want to acknowledge that, right? That there is a ripple effect that goes beyond just the individual, when looking at problem gambling. So let's talk a little bit, now that we've gone through our basic overview of what problem gambling is, let's talk a little bit about the intersection between that and domestic and intimate partner violence. So when we use these terms, domestic violence refers to any violent or aggressive behavior going on in the home. it most often does involve the emotional or violent abuse of a spouse or partner, but it is not limited to that. It could, when using the phrase domestic violence, it could be inclusive of other types of abuse going on in the household too, between people who are not intimate partners. And it also refers to any pattern of behavior in any relationship that's used to gain or maintain power or control over an intimate partner. I think many of you on here have probably worked with, the power wheel before, the power and control wheel. So anything, that encompasses behaviors within that is considered domestic violence. And then intimate partner violence is all of that type of violence that is specific, to both current and former intimate partners. So let's start with a quick overview of some of the overlap in numbers. Now, this data was collected based on people, or at least these first two graphs were based on people who self-identified as having a gambling problem and were also asked about any kind of IPV or interpersonal violence involvement. And this study, which was done in 2017, showed that, look at these numbers, look at this correlation. 38% of people with a gambling problem reported being either a current or past victim of intimate partner violence. That's wild. That's 4 out of 10 people, who come in for or who acknowledge having a gambling problem, also report being a victim of intimate partner violence. And 37%, so very similar, still almost 4 in 10, saying that they are current or previous perpetrators of IPV. So these correlations were so surprising. And, I actually used to work with survivors of intimate partner violence prior to coming to the New York Council on Problem Gambling. And, in my years working with that population, I never heard these stats, right? Like, I had no idea about the extent to which there was a correlation, and there were just high rates of IPV, among people with problem gambling. So, at the council, we said, let's dig into this research a little bit more and see what we can find and share with the community, because, this is pretty significant. We also found, if you look at the third graph, that people who have, this number refers to people who have self-identified as perpetrators of IPV. 11% of them, have reported having a gambling problem. So, if we go back to the national statistics, right, general population, about 1%, or anywhere between 1 and 3%, have various degrees of a gambling problem. We see it's 11% with perpetrators of IPV, very overrepresented in this group, right? So we're definitely seeing correlations on both ends that we wanted to explore a little more. So I had mentioned the power and control wheel a few slides ago. For those of you who maybe have not seen it yet, I wanted to include it in this because it covers, all of the elements that can be part of an abusive relationship. It includes types of abuse that come out not only in physical and sexual violence, but in emotional violence, in economic abuse, right? Which, as you can imagine, there are a lot of overlaps with gambling there, and just, using, utilizing power and control as a tactic, of manipulation when it comes to things like coercion and threats, intimidation, using privilege, denying, minimizing, and blaming, that also has a lot of overlap, with the violent relationships where there's also gambling going on in the home. So, and this is very, very easy to find, the power and control wheel. If you want to find a copy for yourself, very easy to find it online. Just wanted to share it real quick here and bring attention to it as we move forward, to keep in mind all of these things are elements in an abusive relationship. So one study we found, this was done a while ago. This was put out in 2002. But look at this. Look at this staggering overlap. So a study of emergency room visits showed that wives or intimate partners of men who had both gambling problems and abused alcohol. So this is not the wives or intimate partners, but like their spouse or boyfriend or husband. If their spouse, boyfriend, husband had gambling problems and abused alcohol, these women were 50 times more likely to visit an emergency room as a result of being physically abused. So that's just a red flag, to keep in mind if you are working with survivors who report that their domestic partner, or abuser is, or perpetrator is using both gambling and alcohol, that can heighten the potential for the degree of violence that would land them in the emergency room. So we wanted to make sure everybody was, aware of that very, sobering and staggering statistic. So here are, after we looked at the numbers, we started looking at, what are some of the factors, right, that might account for this correlation so high. And in the article that highlighted the increase in ER visits, among people who had perpetrators involved where, they had a gambling and alcohol problem, they talked about some factors that may contribute to this. One factor was gambling related stressors, can create family conflict, right? And maybe a motivation for escalating violence. And this can be the case whether the person with the gambling problem is the survivor, the perpetrator, or both, right? I mean, it can go either way. The financial losses would likely impact both of them. It is very likely, I think somebody even mentioned this at the beginning before we have the presentation, it is likely, that somebody who has a gambling problem and also has an abusive partner, it is likely that if there's losses to that, the partner may take it out on them, right? Same thing flipped, right? If the perpetrator is involved in a gambling problem and is having losses, they may take out the emotional stress of that on the other person. There's also relationship neglect, right? Can be a motivator for escalating violence. And again, that could go either way too. If somebody is the victim, in the abusive relationship dynamic, and they are also gambling, the partner might get angry that they're not paying enough time to them, right? That could cause a violent response. So these are all things, that were mentioned as possible factors. It was also mentioned that victims of IPV, may use gambling as a form of escape, right? To get away from their abusive situation. And it could escalate to a problematic behavior when they do that. And I don't think, we talked much about like the mechanics of gambling addiction at the beginning of this presentation, but just as a review, when people become addicted to gambling, it's because they have a dopamine rush that happens in their brains right after they place a bet, right? They get like a high feeling right after they place that bet. And an addiction can start to develop because the person wants to experience that rush again. And they know that placing a bet will give them that rush. So they keep going because they want to feel that. And if you're using gambling as a way to cope, it can be very tempting, to stay in that space and experience that rush. So that was another factor that contributed to this correlation. Yeah, and additionally, IPV can occur due to the stressors brought on, by gambling behavior. In some cases, perhaps the relationship became more violent or escalated once a gambling behavior took place. So, they both can exacerbate the other one also. So let's talk a little bit about some vulnerable populations and risk factors, because as many of you, are probably thinking, as I was when I first saw this data, okay, so if there are these high correlations, right, between problem gambling and domestic violence, who are the people, the groups of people, individual circumstances that are most likely to experience one or the other? So we put together some data that we found on that, so you can get an idea of vulnerable populations and risk factors. So when looking at people who identify as females, if we look at females' risk factors for developing a problem gambling, females are more likely to start gambling at a later age generally. It's very, very recently, we are seeing a small shift in this, but historically, and mostly, we do see later onsets of gambling age with women. And we also see that females are more likely than other genders to, from what we know so far, to engage in escape gambling, right? So gambling as a way to cope with stress rather than gambling as a way to engage in a social and competitive activity, right? The way identified males are more likely to do. We also see that historically slot machines and lottery tickets are the most common types of gambling for women, because those are the types of gambling that are kind of catered to a mindset where you just want to kind of chill and escape, right? You can just kind of pull the slots, scratch off the tickets. It doesn't take a lot of effort. You can just kind of relax and let that unfold. And sadly, since it is gambling, what's also unfolding, is those dopamine reactions to the in response to placing bets, or buying tickets or playing the slots, which don't happen with everybody, but they do happen with people, who have the vulnerability to develop an addiction. And we usually see with females, what we've seen is a sharp increase in gambling, both initiation of gambling and escalating of existing gambling behaviors. We see a sharp increase in around age 55, 60 for women. So, women in that demographic we're especially concerned about. And some things to consider, if you, notice any, come across any females that might be exhibiting some of these signs of problem gambling, some things to consider are, when asking, okay, could this be an impact of past or present domestic violence? Here's some things to consider. 1 in 4 women do experience severe intimate partner violence, right? So it is not out of the ordinary to think, with any woman, does any past trauma from IPV participate to this? Because the numbers are so high. Women between 18 and 24 have the highest rates of victimization. They have lower rates of problem gambling, but if the victimization, if they did not heal from that earlier in life, it could come out in a gambling problem later on. And 1 in 10 women have also been raped by an intimate partner. So important things to consider. Now, let's look at males. Males are more likely to start gambling at a much younger age. They're much more likely to start in adolescence or young adulthood, more likely to engage in types of gambling that are considered action or escape gambling. And when considering whether or not past or present domestic violence is a factor in males' gambling problems, here is a few things to consider. Men are more likely than other genders to engage in violence for a purpose of coercion and control, right? On a big picture level, it is more likely to be seen in men, and that men who present to the emergency department with injuries inflicted by their female partner also have a high rate of domestic violence perpetration. And it's possible that the female was defending or retaliating for violence against themselves, right? So we also see that when men are in relationships, intimate relationships with women, they may, yes, also be the victims of domestic violence of certain incidents, but it's much more likely that there is violence going back and forth, and it's much more likely that any given incident, was a defensive response on the female's part. So just a few things to consider about males involved in IPV and problem gambling situations. Let's take a look at youth. So, we consider from the problem gambling perspective, we consider youth to be at greater risk for developing this problem because of their stage in their cognitive development. As many of you may know, the brain is vulnerable, to impulsive behavior such as gambling until the frontal lobe parts of our brains are fully formed. And that doesn't happen until we're, at about age 24 or 25. So, even though there are varying degrees and spectrums of this within individuals, generally speaking, when we're younger than that age, our brains are like a car with a fully functioning accelerator, but faulty brakes, right? And if the brakes aren't fully formed yet, we have a greater difficulty from a brain development perspective, stopping impulsive behaviors once they start, right? So that's why we're definitely concerned about youth as a special vulnerable population when it comes to gambling. And if we look at things like brain development, impulsivity, and ACE scores, which look at adverse childhood experience, we see that those can impact domestic violence among young people too. Some data we found is that between 10 and 20% of youth have been impacted by dating violence. And we also found that the risk is much higher between youth who have existing high ACE scores and a history of domestic violence in their home. So we see those rates much higher, amongst youth who have been impacted, by this previous trauma. The data also found that 62% of pregnant teens have a history of domestic violence or sexual assault. So, the tie-in with youth is that even though youth may be less likely to come forward, about these things, about, problem gambling and domestic or intimate partner violence than adults are, it is definitely happening with them. And youth who've already experienced trauma or violence are really at a higher risk of both, because any kind of trauma, makes you higher risk for a gambling problem, because there is the propensity to use it to soothe and escape, right? If the trauma has not already been addressed and healed in another way. So let's take a look at more into older adults. I had mentioned that we do see an increase around age 55, 60, an increase in problematic gambling among women. And when it comes to older adults in general, 1 in 10 of them may face a significant risk of getting addicted to gambling. And, a lot of this is because of the stage of life, that these older adults are in. They may be dealing with, major stressors like grief, loss, or financial need for the first time, isolation, loneliness, coping with having perhaps different abilities, than they used to. So a lot of factors, play into the reasons why we see a higher risk in older adults. And when looking at whether or not the impact of past or present domestic violence may be a factor, you can consider these things. Again, any unresolved trauma related to DV or IPV earlier in their life may be impacting their current behavior. Consider the fact that abuse, if there's any abuse going on that is either from an intimate partner or somebody else living in the home, it does most commonly happen in the older adult's home, right? Which may add an increasing difficulty for an older adult to cope with that, right? Which can make the escape into gambling an attractive option. And, also consider that tactics used by the perpetrator toward the victim in abusive relationship situations are similar among older adults than they are with younger adults, right? Like all of the tactics mentioned in the power and control wheel I showed earlier are the same, right, with younger and older adults. Although with older adults, we do find that there are greater risks of financial exploitation, right? Which, as you can imagine, if you have somebody who is financially exploiting somebody else in their household, you can see how a gambling problem could play into both ends of that, right? The gambling could be both a motivator and a cause of the financial exploitation, and then the two can kind of feed off of each other in a cycle once they're happening together. So that's an important consideration too when looking at the intersection between those two in areas where there's financial exploitation, particularly among older adults, because that's the most common. Okay. So Black, Indigenous, and people of color. What we know so far about BIPOC individuals is that Black and Indigenous people have a higher risk for both problem gambling and domestic violence than white people do. What we also know, what we've seen from the data so far, is that Black people in particular struggle with problem gambling and intimate partner victimhood at twice the rate of white people. So even though at this point we don't have more specific data than that in terms of how being a Black or Indigenous person impacts these two things together, the problem gambling and domestic violence, we know that separately with both issues, all of the research has said that there is a higher risk for Black and Indigenous folks, and that the risk is double for people who are Black. So we want to consider that moving forward too. Definitely consider whether or not and often too, with these higher risk factors, it absolutely has a lot to do with what was mentioned a couple of slides ago about the higher ACE scores being a risk factor as well. We do know that BIPOC individuals are far more likely to grow up in poverty. That poverty is likely to result in trauma, just as things such as growing up in an abusive household might. So, when looking at these correlations, we also want to acknowledge that the cycles of poverty, right, and experiences with all of the trauma that comes from that are very likely a huge contributing factor to poor outcomes, when it comes to problem gambling later on and to being victimized. So looking at the LGBTQIA population, data is very limited for how problem gambling impacts the LGBTQIA community. We have a whole separate presentation on this. Basically, there's really only been 3 studies done ever that have looked at this. There is more information about how problem gambling impacts domestic violence and interpersonal violence. Still not nearly enough though, as there is with heterosexual couples. So the preface here is that the data I'm about to share is a little bit limited on both ends, but it's what we do have, and we want to make it available. So the data we have is that LGBTQIA individuals are at higher risk than their heterosexual counterparts for developing a problem with gambling. And if you want to, just to get an idea of what some of the numbers look like, if you remember back when we did the map of the US and talked about the national data, if you remember, okay, gambling disorder about 1%, problem gambling about 2 to 3% in the general population. Well, the studies done so far with LGBTQIA plus individuals have shown that the prevalence of problem gambling among people who identify as LGBTQIA is at about 20%. So that's significant. If you look at, okay, the general population is 3%, you have this way overrepresented in the LGBTQIA community. And even though it's based on very limited data, the fact that all of the sources, so far have shown this degree of correlation definitely warrants the need for further exploration, into why this is the case and into the need for culturally competent services specific to this and the BIPOC, population when treating both of these issues. So the data we know about LGBTQIA plus couples, is that they do experience similar rates of intimate partner violence to heterosexual couples. And this is important for us to know, because it's important to remember that IPV is not just a male-female dynamic, even though males are more, even though the power dynamic, right, between males and females is often more defined and concrete than it is in same-sex relationships. It still happens in same-sex relationships. And if you look at the power and control wheel, there are still, a same-sex couple is still capable of using those tactics of manipulation. And, except instead of the power dynamic being based on gender, the power dynamic might be based on other things, right? Who makes more money? If there is, a same-sex couple, but perhaps, one of them is white, one of them is a person of color, right? One of them might have more like social capital, right? And power that way than the other one. So you can still see, you can and do still see abusive relationships happen and violent relationships happen in those contexts. It's just it's just power is shown, the factors that contribute to the power maybe just things other than gender in that situation. So those are some of the takeaways of what we know about how PG and DV impact each of these communities. I don't think there's been anything done about the overlap in this particular community so far, but since we know, people, in same-sex couples or people who identify on the gender spectrum, elsewhere than male or female are all still could potentially be impacted, perhaps, a lot more than their counterparts in the general population by both of these issues. Just a reminder to everybody to please mute your phone or mute your Zoom so we don't hear background noise. Thank you. So we also wanted to include a section in here about the impact of COVID-19 on both of these issues, because what we saw across the board was that COVID-19 exacerbated, both of these issues if they were happening before, and also created new dynamics during the lockdown that even though the lockdown is over, people are still, I'm sure, feeling the impact about now. So what we saw in problem gambling is we saw a massive shift to online gambling platforms that had been in motion for years before the pandemic, but it escalated, right? Once the casinos shut down, people had to start going online, right? And accessing, virtual blackjack tables or slot machines. we're also seeing even with the lottery ticket now, like you can buy lotto tickets from your phone now through the New York State Lottery, and that happened during the pandemic as well. So major shift to online platforms. We saw, in fact, one study showed that was done a couple of months into the pandemic, showed that people who gambled online were, they were able to tell by looking at their IP addresses that these users were spending more time on gambling websites and betting more money. So that gives somewhat of an indicator as to what the increase in problem gambling behavior may have looked like when these platforms became more accessible. What we also saw during the pandemic in problem gambling was that there was a reduction in utilizing treatment and support groups. It was kind of chaos for the first few months, and I think that, sometimes it can be difficult enough, finding out where to get information about where to go for problem gambling support. We are trying to reduce those barriers, right? And make that, make all that information more accessible at the PGRC. But generally speaking, navigating your way through finding help and treatment and support can be complicated enough already. And when things started shutting down and people kind of had to figure out what's online and what's not, and people had barriers to accessing services online because maybe they don't have reliable access to good Wi-Fi or a laptop or a smartphone. Maybe they do have access to all those things, but they're living in a situation where they don't have like privacy to access treatment and support that way. So a lot of people that probably needed that help were unable to access it because of any of those barriers. So that was something that definitely increased rates, not only with problem gambling, but with other addictions too, according to, what we heard, with our colleagues in the, chemical dependency field. And problem and, the impact of COVID-19, a lot of people experienced increased financial and emotional stress for various reasons, and anytime there is increased financial and emotional stress, people are more vulnerable, to coping with behaviors such as gambling. In fact, there was a study done after the 2008 financial crisis that showed an increase in problem gambling, kind of similar, to what we've seen here, minus the online platforms. It was more people were reporting engaging in gambling as a consequence of having a financial loss and feeling like they needed quick money. So a lot of correlations there. In terms of the increase in domestic violence during COVID-19, social isolation is just, living with an abusive or a potentially abusive partner or family member in your home, living with them, plus being cut off from the rest of the world, like we were when isolating during the pandemic, really increases the risk, for domestic violence situations to get potentially serious. And we saw this across the country when domestic violence crisis hotlines had a surge in callers. We also saw, similar to what problem gambling, barriers to accessing services, right? If you're with an abusive partner or abusive family member who's using power and control tactics with you, and you're with them all day, they might be looking your phone, tracking what you Google, tracking who you contact, tracking your browser history. So that does present a serious barrier to getting information and getting help. So that likely led to the increase we saw in domestic violence incidents during the pandemic as well. And before we start talking a little bit, transitioning more into, the what's next part about this, right? How do we get help if we're in this situation or know somebody who might be? I just want to acknowledge the relationship between problem gambling and suicide, because it really speaks to kind of the core of why we're doing this, right? And why we are focusing on problem gambling as such a serious issue, because I think, we all know by this point that intimate partner violence and domestic violence can be deadly, and problem gambling can too, because a comprehensive study done in 2015 showed that people who have a gambling problem, not even necessarily gambling disorder, it's inclusive of gambling disorder, but like problem gambling and higher, right? People who have problem gambling or gambling disorder are 18%. 18% of them have had a suicide attempt at some point in their lives, or completed suicide from that attempt. 18%. That is 1 in 5. That is staggering. That is a higher rate of suicide attempt and completion than any other addiction. So that's part of why we really want to emphasize, that this is an issue that is really worth people's time to address, right? And we recognize that it often happens intersectionally, right? It is often not in a silo. And I really thank, all of the DV and IPV providers, and advocates who are joining us today, because of the overlap between these two, you all are in a really good position to bring problem gambling into the conversation, right? Because that's where it starts. Nobody is going to be able to help people work through this problem if there's not that initial check-in, right? If it's not even on the radar, and our hope is that, the more that this is discussed in a preventative way, right? The less harm that it will cause, in terms of, this degree of devastation and loss of life, and when we spoke earlier about the ways that problem gambling, please everybody mute your effort. Thank you. And when we spoke earlier about the ways that problem gambling impacts other people, right? It can impact up to 10 other people. This is one of the ways it does, right? Because sometimes this addiction does result in completed suicides, and the loss, that comes from that can certainly impact others. Okay. So, now that you have all of the data about these correlations and risk factors, let's talk a little bit about next steps. And, one of those is making yourself aware, if you aren't already, of our problem gambling resource centers throughout New York State. Our website, nyproblemgamblinghelp.org, has a list of has an interactive map, where you can find your local problem gambling resource center. And as we mentioned earlier, our PGRCs carry out the mission of our larger organization on local levels, raising awareness about problem gambling, right? Which is exactly what I'm doing right now, except all over the state, right? With groups of people all over the state, raising awareness about problem gambling and connecting people to the support and services that they need. And I'm going to talk a little bit more about what that looks like concretely right now. So when you go to our website, and look up your local problem gambling resource center, you'll see that there's a number, associated with each regional resource center. And when somebody calls our resource center, they'll be connected with one of their regional program managers. And these program managers maintain relationships with the clinicians in our network that are available to treat not only the individual who has a gambling problem, but anybody who's been impacted by it, right? Any loved one who's been impacted by another's behavior. And our model is kind of unique because what we've done at the PGRCs is we have received state funding to essentially recruit and provide training for clinicians who have an existing private practice, who are willing to take our clients. And part of the funding, that we receive is put aside to pay the clinicians directly when we're not able to make an insurance match. I mean, a lot of people hear, private practice, oh, I can't afford that. How can people who have a gambling problem and have no money afford that? Well, we recognized that barrier before we created, this system. And, we have made, through our PGRCs, a way for people to access, that kind of help without money coming out of their own pocket, if there's no insurance match, right? If, let's say, their insurance isn't accepted by any of the private practices in their area, or they're uninsured, or they have insurance but can't afford the copay, any of those situations, they can talk that through with our program manager, and our program manager can connect them to these therapists, many of whom at this point, are doing, hybrid combinations, right? So they're at this stage in the pandemic, in most regions, there are both in-person and virtual options for receiving that help. And just want to kind of stress what I said a couple minutes ago, that anybody impacted by problem gambling can get this. So if you have a stressed out spouse or parent or child who has no idea what to do, they are eligible for these services, including the financial assistance and accessing it if they need to. And, we meet callers where they're at. Sometimes people call us, they just kind of need support and want information. They may not be ready, to move forward to connect with any of the therapists yet. And that's okay. We do have a lot of other resources that we can provide too. We can collect them to local mutual aid recovery groups, including GA, Gamanon, Smart Recovery. We do stay in the loop with any other services that are in the area. So for example, if there is a situation that comes our way where there is both a problem gambling and domestic violence concerns, we all have partnerships with other DV organizations and resources in the area. So, these program managers at our resource centers can be really helpful, in a variety of ways. And if you happen to be, a licensed social worker, psychologist, marriage and family therapist, or a mental health counselor, in New York State with your own private practice, and you're interested in joining our network, again, go to our website, nyproblemgamblinghelp.org, find the point of contact in your region, and our program managers would be happy to chat with you about that process as well, and what that would look like for you. Okay, and this is actually not my contact information. This is the slide from our Western region, but again, nyproblemgamblinghelp.org. Go there to find the contact information for your local PGRC.